Senator Alsobrooks.
Thank you. Thank you so much, Chair Scott. Thank you so much, Ranking Member Gillibrand, for hosting today's hearing. And thank you so much as well to our witnesses for being here. What we know is far too many seniors still face the cruel reality of needing medication that they can't reliably access or afford. High drug prices, unexpected shortages, and now Secretary Kennedy's policies are preventing Americans from accessing the medicine and vaccines that will keep them safe and healthy. This couldn't be a more relevant topic. In the past few weeks, I've heard from my constituents, so many seniors across our state who are eligible for the latest COVID vaccine, and they are now being turned away because of the confusion caused by Secretary Kennedy's new guidelines, and others are being told that their local pharmacy is struggling to stock the vaccine because of the lag between FDA approval and the forthcoming recommendations from the Advisory Committee on Immunization Practices. So when it comes to vaccines, we know that that so much doubt is being cast on life-saving vaccines as well as dismantling our public health infrastructure. And that's why this conversation is so critical. Seniors deserve not just reliable medications, but a health system that they can trust to put science and safety above politics. My first question is for Dr. Piervincenzi, and I'd like to ask you, when we see how fragile our drug supply chains can be when it comes to medicines that seniors rely on, and vaccines we know are no different. This is a time, as I've mentioned, when Secretary Kennedy, I believe, is really destabilizing public trust in vaccines, and older Americans can't afford disruptions to flu, RSV, or COVID. So I would like to know, how has the confusion regarding vaccine approvals and recommendations this year made seniors across the country less safe?
Thank you, Senator. An interesting fact on the vaccines is, compared to many of the low-cost generics, there are quite a few manufactured in the United States. And if you consider United States, Europe, Canada, there's a disproportionately high quantity. So there is the ability for FDA to do more robust inspections, including surprise, for majority of vaccine sites. And so the public should have more confidence, if anything, that they're able to rely on the quality of the vaccines. As a complex biologic, there are linkages to the complex generics that are the ones showing up on the shortage lists the most. And because they're the kind of medicines used in hospital, just for that reason alone, they are impacting two groups the most: the most senior, especially in oncology, and the youngest, the pediatric population, also tending to be oncology, but not only. And these two populations have been most affected. There's an extra layer to this problem, is that these are the medicines that are least substitutable. It is an art form to try to treat these cancers. We haven't cured cancer, so best we can do is slow it down in many cases. But a small change from one chemotherapy to another, and the progression advances, it's the person's life is at stake. So the vulnerability isn't just about the medicine, but about the patient and essentially what the next best alternative is. So from a quality standpoint, items like vaccines are very different because they're given, of course, to a healthy patient. So you're measuring it in two very different ways. However, a poor quality vaccine, you're only going to test that perhaps 30 or 40 years later when you're exposed to a disease. So you think about when you need to rely on quality, I can't think of a medicine more important than vaccines. Thank you.
Thank you. Now, I have one other question regarding, or two actually. The next question is regarding transparency. And what we know is, for seniors in particular, and this is for any witness, it's not just about how the drug or where the drug is manufactured, but it's whether or not they can trust that what's in their pill bottle is safe, effective, and available when they need it. Too often, our system reacts after a crisis instead of putting preventive measures in place, leaving seniors and their caregivers to find out too late that their medication is suddenly unavailable. So how should we be thinking about transparency, not just as a tool for regulators and industry, but as a preventive measure that empowers patients, especially seniors, to make informed choices about their medications and avoid being blindsided by shortages? And that's for any witness.
I'll be brief to allow others time as well. I would emphasize pharmacy. if I might. So there's a big gap to the patient in knowledge and understanding, but we have an army of hundreds of thousands of healthcare practitioners called pharmacists out across our country who are unusually close to patients, have access on essentially a prescription by prescription basis. That's a huge positive. There's an opportunity to have them play a more active role when it comes to supply chain and quality. It's not typically a topic that they touch. And so I think if we want to be able to help empower patients, we're going to have to solve this through partnership with pharmacy and pharmacy organizations that I know are very open and willing to have this conversation. Thank you.
Thank you.
Thank you for the question on transparency. So this is something I've spent a lot of time working on, and when our paper that I talked about in my introduction got published, our author team started getting random emails from the public, scared emails about how can I find out where my drug is made? I don't know how to figure this out. So this is something that we were able to do in this study we published, but it is very difficult. And this is why we advocate for forcing firms to put the country, the location on the label so that it's transparent for everyone. We've developed a website that we're hoping to launch where you can type in a national drug code number and a flag will pop up to tell the consumer this is where it's made. Even developing that website by this author team that we worked on this paper has been very hard for us because it's a difficult step to go from a national drug code, which is on every drug label, to a country manufacturer, which is very hard to find out.
Thank you.